modalities that go beyond just the surgery, the chemotherapy, the radiation, hormonal therapy, so that they know that there's something out there that we can help them with. So once they go through that initial emotions and so forth, I try to help them get stronger so that they can concentrate on making it through the treatment rather than emphasizing what they've been through and why me.
Off camera, you all were talking for a while. I wish the camera was rolling. It was like perfect, and I doubt if we're going to be able to reproduce it. But do you mind if you talk a little bit, how it started for you, what were the options that you were given, what you actually chose in doing, and you can kind of, kind of go along with that, and maybe this is about 3 years ago, correct? 2-3 years ago. Things haven't changed that much probably in 2-3 years, but talk a little bit what you did and how you would consult with her. I mean, I'm sure this is something that you go through on a daily basis, with patients.
Well, when I was diagnosed, I immediately went to a support group for young cancer survivors.
Were you young? Is she considered young for this? Okay.
I was 46 at the time. And everyone that I've met in the group, in fact, I was the oldest one in the group, everyone was in their 20s and 30s. So that was so helpful because everyone was at a different point in a different stage, so you knew what you had ahead of you. And it was very, very helpful to have the other girls to...
Did they have any patients that were much further along, let's say, like where you would be, where you could mentor maybe some of the younger people, which I'm sure would be important, somebody could help you along.
Absolutely. In fact, most of the girls that I met, they were already through chemo. We all met for dinner one day, and I walked in, and they were these beautiful girls. You wouldn't have thought a thing was wrong. And went into the ladies' room. They took off their wigs and pulled up their shirt. It was devastating, but it was good, because then I knew what to look forward to, and that it was going to be like the norm, the new normal thing for me.
Well, and you also had somebody that went through it, and you see how they were handling it. And everybody's different, not everybody handles things the same.
And then there were the ones that all their hair was coming back, and they had great breasts. It was good. There was light at the end of the tunnel.
Question, I had heard just over the years that the younger, you mentioned younger, the younger the diagnosis, usually the worse the prognosis. I mean, is that true, or did somebody mention that incorrectly, or?
It used to be true, but I think we're making a difference. It used
so
to
one
be
time
true.
That was true, and this could have been 15, 20 years somebody had mentioned this. But.
And to a certain extent it still is, because you don't think about it when you're 20 or 30. All the screening mechanisms start at the age of 40. So, but now with the increased awareness and the word getting out that you can get in your 20s and 30s, I think women are becoming more diligent about their self-breast exams.
Is it from delayed diagnosis, but it's not a more aggressive cancer than when they're younger?
It can be. Okay. There's certain things we look at in terms of the characteristics of the tumor, and there are certain things in the tumor itself that can say this is a more aggressive type of cancer.
Is it familial? I mean, is it genetic of any kind? I mean,
5% of tumors are genetic, 10 to 15% are familial. So we'll see it running in the family, but when we test it for the 2 known genes that we have, they'll test negative.
Now you have a little educational...
Well, I brought this along because I think self-breast examination is pretty important, and what this basically states is if you don't do your exams, by the time you find it, it could almost be 3.6 centimeters in size. And if you do them frequently, as you do them more regularly, you can actually pick up something abnormal at a smaller size, so you end up with a diagnosis at an earlier stage, and your prognosis is that much better. The higher the stage, the prognosis obviously decreases. So if you can get picked up at a 1 centimeter size tumor and you're stage 1, theoretically, you have up to 100% 5-year survival.
Now, as the 5-year, you hear a lot of things that if you can make 5 years, they consider it, that's the good point to get to. Yes. Is it the same with this?
Yes. Yeah.
Let's talk a little bit more. I mean, earlier Tommy had said something about chemo versus radiation. Let's talk about some of the options as far as treatment goes. Obviously, you can excise it or something, correct? And you do that?
Right.
Okay. So let's talk about the actual treatment options as a surgeon, what you, maybe from least invasive or most frequent, let's go most frequent to some of the more procedures that are a little less frequently seen, probably the more aggressive stage.
Well, we were kind of talking beforehand too. From a surgical standpoint, there's options of trying to conserve your breast with a lumpectomy, which is usually followed by radiation therapy. The other option is to do the mastectomy, and sometimes patients will choose to have both sides removed, one with the cancer and the other side just because they don't want to deal with the whole situation later. The radiation, again, is always affiliated with a lumpectomy, but can be necessary with a mastectomy as well. And chemotherapy, really, we need to truly stage the tumor. So it's not just looking at the size of the tumor in the breast, but also evaluating the lymph nodes, usually in the armpit area, the axilla, to see if they're involved. And if they're involved, then chemotherapy would be necessary.
Who makes that call, you or an oncologist or both together? Or?
I think through the experience of taking care of patients that once surgery is done, they go on to oncology, and then they come back and we get to learn what they went through. Surgeons also get an idea of what is going to be recommended by the oncologist. So I will prepare my patient in the office after the surgery is done to let them know most likely you're going to need chemotherapy or radiation. So when they go there, they already have the idea, but the formal recommendations come from oncology.
What was the year you did your first mastectomy? I'm just trying to get a time frame here.
1999.
Okay, so we're talking about 10 years,
ago.
right? 10 years, things have changed? I mean, is there a new procedure, surgical? Obviously, diagnosis is always get a little more sensitive over time. Is there anything changed or something coming up that you foresee or have heard?
What's changed is how we evaluate lymph nodes. Before, it was a standard make an incision in the armpit area and take out all the lymph nodes that are in that region. Now we do sentinel lymph node biopsy, which allows women to have less lymph nodes removed, but still get the same information that is necessary to stage and recommend additional treatment. So that's something that's come up within the last 8 years. It was originally used for skin cancers, and that has helped women not have as many complications with swelling or nerve deficits and things like that. As far as reconstruction, there are some new reconstructive options as well that plastic surgeons are now doing so that there's less returns to the operating room and better cosmetic result.
Any complications? Obviously, every surgery has a risk. Everything has a risk. What are the major, let's say, 2 complications that somebody, like the procedure that Tommy had, what would we be looking at?
Making sure that the skin heals adequately. The idea is to make sure all the breast tissue is removed, but there's fatty tissue right above it there where the blood vessels go to supply the skin. So making sure that there's enough blood supply to that overlying skin so that there's adequate healing thereafter. From a cancer standpoint, obviously making sure that all the breast tissue is removed so that there's a very low chance for any type of recurrence. From a cosmetic or plastic surgery standpoint, making sure that the overall symmetry is good so that the patient can move on and feel good about themselves and go on with their
As far as
lives.
retesting, let's say a patient has, I'm sure you all, I don't know, once a year, once every 6 months, what's usually the time frame as far as retesting?
Screening mammogram still once a year after the age of 40. Doing a breast examination by the healthcare professional starts annually around the age of 30. And self-breast examinations by the patient on a monthly basis should start at the age of 30.
Do a lot of patients, let's say Tommy has a family doctor who would refer, which is probably a very frequent route that a patient would take, do a lot of, in Tommy's situation, you would do the exams from that point on, or they kind of go back to their family docs? Or?
Usually on an annual basis, they'll go to the family physician. There are some of my patients who will come back to me and feel more comfortable that I do it. So it just depends on how it's set up with that patient and physician.
Well, Tommy, it's your turn. Okay, let's talk about this. Okay, something obviously that you developed, and if you want to hold that, and just talk about some of the products. And well, first, I talked to a friend of yours, a very good friend of yours, my good friend John, who kind of came to me and said, I thought, this is a very appropriate topic right now. But let's talk about what was your main initial motivator as far as starting She Rocks.
Well, I met a girl in my support group, and she started out with ovarian cancer. She didn't know about the BRCA testing, which is the genetic testing. It was prevalent in her family, it ran in her family. Her mom had it, her grandma had it. Her doctor did not tell her about this test, so she didn't do the preventative measures. Long story, she had the ovarian cancer, then she developed breast cancer, and then her ovarian cancer came back. She did lose her battle with that. But it's just very important that you realize early detection can save your life.
Obviously, you're one of the experts. I mean, you see all ends of it. Ignoring something doesn't make it go away.